Basically, the goal of the neck lift is to rejuvenate and refresh and turn back the clock about 10 years. Well, neck lift is a surgical procedure to improve the contouring of the neck. Basically, there are 3 layers in the facial anatomy that get affected by aging process as we get older. There is another layer at the deeper layer. It's called SMAS, which is tissue similar to fascia that is deeper to the fatty layer. So we have skin, fat, and that fascia, the SMAS, works like a netting covering all this area of the face and converts to become platysmal muscle and goes down here, attaches to clavicle. So that's the one that holds the whole face and neck like this when you are young. As a result of aging, sun damage, hormonal changes, you lose collagen and elastin in that tissue. So the tissue that was firm here, that now that SMAS and platysmal become loose and everything starts hanging here. So you start getting the marionette line, the jowl, and the neck, the tissue moves forward, and you start seeing the edges of these bands here, which is continuum of that SMAS. As a surgeon, the goal is to reposition that SMAS to a new position that fits the person sitting in front of me. The main goal that people come and they want to have the neck lift done is to have a rejuvenated and refreshed neck that looks smooth and has higher definition at the jawline. Whenever a person feels that their neck is aged more than what their actual age is, meaning if they look at in the mirror and a video, a selfie, and they see loose skin, they could be in their 40s and they have genetic issues that predispose them to have what some people call a turkey neck, but it can start from mid-40s to go all the way to obviously 60s. So whenever is that bothering the patient, the individuals as a part of their face and neck, then we have to do treatment for it. Basically, the goal of the neck lift is to rejuvenate and refresh and turn back the clock about 10 years, and the aging process will continue to go on. So basically, if you're 50 and you get a neck lift done, and then at your 60, your neck look like when you were in your 50s. So basically, it set the clock back. The aging process we can stop, but the result will look good for the age that you're going to be. So if you're just doing a pure neck lift and not lower face and neck lift, or in combination, the incision under the chin area will heal in 8 to 10 days without much of visibility. In the back of the ear, it takes about a month and a half to 2 months for that to soften and be less visible. So a well-performed neck lift should not have much of scarring after 2 months.